Welcome to the deep dive. We're here to cut through the noise, pull out the really potent insights from key sources, and, well, give you that shortcut to being genuinely well-informed. Today, we're stepping into a really high-stakes World Healthcare Administration. Specifically, we're focusing on a role that's absolutely pivotal, the surgery scheduler.
It really is.
Just think about the kind of precision needed, the calm you need under pressure. You're orchestrating these incredibly complex schedules where just one slip-up, well, it can have huge consequences. It's definitely more than just a job. It's a vital career.
Absolutely vital. The smooth running of a surgical department often hinges on that role.
So our mission today, we're going to dissect this fascinating source we found. It's a set of 6 pretty common interview questions for a surgery scheduler, and it comes with expert answers suggested by Kaplan. But we're not just going to read you the answers. Our goal is to dig deeper, to extract the crucial insights, the things maybe not explicitly said in those questions. We want to give you, listening in, a really clear roadmap, help you understand not just the tasks listed on a job description, but the underlying skills, the mindset employers are actually looking for. What makes a candidate truly stand out? So let's unpack this.
And that really is the core of it, isn't it? What's so interesting here is how these questions, they might seem straightforward, maybe even simple.
Yeah, at first glance.
But they're designed to probe way beyond just technical knowledge. They're digging into how you think, how you react under pressure, how you manage the, frankly, intense demands of a busy healthcare setting. It's about showing you have a very specific, almost indispensable mindset.
Absolutely. And I think that the theme we'll probably keep circling back to is that, okay, Kaplan gives you these great answers, right? But the real value for you, the listener, is figuring out the intent behind each question.
The why.
It's exactly. What are the critical skills they're trying to uncover? Often it's reading between the lines. Let's maybe imagine someone, let's call her Sarah. She's a new surgery scheduler, first few weeks on the job. These questions, they're basically a preview of the challenges she's going to face, probably every single day.
That's a great way to frame it. It's the day-to-day reality check.
Okay, so let's start with that foundational question, the one that often kicks things off in these interviews. Can you explain your experience with scheduling surgeries? Seems simple, but what are they really looking for here?
Well, yes, it gauges your practical experience, obviously, but maybe more importantly, your proficiency and, crucially, your adaptability. Kaplan's answer emphasizes showing experience across multiple specialties. They list orthopedic, general, neurosurgeries.
Okay.
Now, this isn't just about logging hours. It points to the need for breadth, complexity. Someone who's scheduled, say, a complex neurosurgery, that shows a different level of organization, different problem-solving skills than someone who's only dealt with one type of simpler procedure.
Right, the scope matters.
Definitely. And you also have to mention being proficient with the scheduling software, various types, ideally. And this is key, showing a good understanding of the surgical process itself and why accurate, timely scheduling is so important.
So for you listening, it's not just about listing jobs you've had. It's about painting a picture of the depth and the variety of what you've handled. It implies that a top scheduler really gets the whole clinical workflow, not just their little piece of the puzzle.
Exactly, seeing the bigger picture.
Okay, now let's move to something I think anyone in healthcare knows all too well. Chaos. Unexpected disruptions.
Oh, yeah.
Here's where, the rubber meets the road. The question, how do you handle last-minute schedule changes or cancellations? Because this will happen. It's like a daily fire drill for some.
It really is. And this question, it cuts right to the heart of assessing your problem-solving skills, your adaptability, and how patient-focused you are. The Kaplan answer outlines a really solid, methodical approach. First, you assess the urgency. That's critical. Not all changes carry the same weight.
Right. Triage it first.
Exactly. Then you work with the surgeon, nursing staff, and other relevant parties to find a workable alternative. This really underscores the collaborative piece of the job.
You're not working in a vacuum.
Not at all. And super important, you keep the patient informed of any changes while making sure they still get the necessary care in a timely manner. Think about it. An empty operating room costs money instantly. A patient left hanging not knowing what's going on, that causes huge anxiety. So the scheduler's quick, calm response here, it can literally save time, money, and a lot of emotional distress.
That's fascinating. So it's much more than just shuffling appointments around. It's rapid decision-making, crystal clear communication, and teamwork under pressure, all while keeping the patient's needs right at the center. It paints a picture of someone who's like the calm anchor in a storm.
That's a perfect analogy. The anchor.
Okay, let's shift gears a bit. Let's talk about what can sometimes be a silent enabler or maybe a massive bottleneck in the whole surgical process,
Yeah.
the admin and financial stuff.
Ah, yes. The paperwork trail.
Question 3 gets right into it. Can you explain your experience with insurance pre-authorizations and referrals?
Okay, this might sound like dry admin, but it is absolutely critical. Critical for patient access, critical for the smooth operation of the whole surgical center. The source stresses being familiar with the process, obviously, but also understanding the importance of obtaining these approvals in a timely manner to avoid delays.
Timeliness again.
Always. And what people sometimes underestimate is just how complex this is. You need to know the different requirements for different insurance providers. They're not all the same.
Oh, I bet.
And you need the ability to navigate through the process efficiently, because one missed pre-auth, one delayed referral, that could postpone a vital surgery or land a patient with a massive unexpected bill. It can completely sour their experience.
So for you, the listener, the takeaway here is that being on top of this, being accurate and timely, it's not just about checking boxes. It directly impacts patient trust, patient access, and the financial health of the hospital or clinic. It's like a gatekeeper role, really.
A very important gatekeeper, yes. Ensuring patients get the cure they need when they need it without financial surprises.
All right, next question. This one really gets at the sheer weight of responsibility, making sure everything is perfectly set up for a successful operation. How do you ensure that all necessary information is collected and communicated prior to a surgery? It sounds almost like doing a pre-flight check on a plane.
It kind of is. This highlights that core theme of being absolutely meticulous and having robust communication channels. This is essential for patient safety, avoiding delays. The Kaplan answer lays out a very clear, proactive process. First, you collect all necessary information from the patient, the surgeon, other relevant people. It implies you need to be almost investigative sometimes, proactive.
Making sure you have everything.
Exactly. Then you communicate this information to the appropriate individuals, like the nursing staff, anesthesia, whoever needs to know. So everyone's prepared, everyone's on the same page, and they mention a great practical tip, using a checklist and review it before the surgery. That shows a systematic approach, a way to prevent things falling through the cracks.
Yeah, the checklist makes sense.
Imagine a surgeon walking into the OR expecting one procedure or needing specific equipment and finding something else because some detail was missed. The stakes are incredibly high.
That paints a very clear picture. It really shows how the scheduler acts as this central hub, this crucial node for vital information flow. You're not just managing time slots, you're orchestrating the whole thing, making sure every piece is in place before the curtain goes up.
Well put. Orchestrator is a good word for it.
Okay, now let's talk about the human element. Because high-pressure environments inevitably involve, well, people, and sometimes challenges between people.
Conflicts arise.
So question 5 asks, how do you handle conflicts or issues that may arise during the surgical scheduling process? Maybe two surgeons want the same OR time.
Right.
Or there's a resource clash.
Right, and this dives into those crucial soft skills. Conflict resolution, having a collaborative mindset, these are just as vital as any technical scheduling skill. The key points from the answer are, 1, approach these situations with a problem-solving mindset. It's not about blame, it's not about winning, it's about finding a fix.
Focus on your solution.
Exactly. 2, you need to work with all relevant parties to find a solution that is in the best interest of the patient. Again, patient focus above everything.
Prioritizing the patient. Always.
Always. And 3rd, something practical. Document any conflicts or issues. This isn't about tattling. It's for learning, for future reference, maybe process improvement. It shows accountability. You're acting like an agile mediator, maybe, not just someone enforcing rules.
That's a great summary. So beyond just making the schedule work, you need strong people skills, strong resolution skills. You need to be empathetic, but also clear and focused on getting a good outcome. A solution finder, like you said, not just a schedule maker when things get tense.
Precisely. It's a diplomatic role as much as a logistical one sometimes.
Okay, and wrapping up the specific questions, we land on technology, which is, of course, central to everything now. Can you explain your experience with EHR systems and how you use them in your role?
EHR, electronic health records, yeah, this is fundamental. This question checks not just your technical skill, your proficiency, but also your understanding of something hugely important, data security.
Right, the privacy aspect.
Hugely important. EHRs are the digital backbone, right? Where all the patient information lives. It allows communication across departments. So the Taplin answer talks about proficiency in using them for scheduling, managing patient information, communicating with other healthcare professionals via the system. But crucially, it highlights understanding the importance of maintaining the confidentiality and security of patient information and strictly adhering to HIPAA regulations.
HIPAA, yeah. That's the big one for patient privacy in the U.S.
Absolutely critical for patient trust, for legal compliance. Data integrity here is just paramount. One tiny error in an electronic record, it can ripple through that patient's entire care journey, potentially with serious consequences.
That really drives it home. This role is such a blend. You need the tech skills, yes, but also this deep understanding of the legal side, the ethical responsibilities. You're not just inputting data, you're a guardian of highly sensitive information,
Right.
directly impacting safety and trust.
A guardian is a good way to think about it.
Yeah.
Yeah.
Now, it's worth remembering, I think, that these interview questions, as vital as they don't exist in isolation. They fit into this bigger picture, this whole career ecosystem.
That's a good point.
And the Kaplan source actually points to some broader resources they offer through their Community Career Center, which kind of expands on how you can approach your career journey more strategically.
Exactly. And looking at those resources shows that prepping for an interview is really just one piece of a much larger strategy for your career. It's not just about memorizing answers for one specific interview. For instance, they mention an interview coach. Describe it as a revolutionary tool to transform your interview performance. So it's not just practice, it's about building unwavering confidence, refining how you communicate.
Sounds useful.
Yeah. And they have an offer analyzer tool, its purpose, to compare your job offer and compensation package with what the market pays today. That's incredibly valuable for making sure you're getting paid fairly.
Absolutely. Know your worth.
Then there's creating a job seeker account to, as they say, elevate your visibility. Kaplan recruiters apparently vet your resume and connect you with employers they partner with, so that's a more proactive way to find opportunities. And hopefully they also list some related jobs, things like appointment scheduler, certified medical administrative assistant, client service coordinator, hospital admissions clerk.
Ah, so showing transferable skills.
Exactly. It broadens your perspective, shows how skills you build as, say, a surgery scheduler can open doors to other roles within healthcare admin. It maps out potential pathways.
That's a fantastic range of support, actually. It really underscores that landing a critical role like surgery scheduler isn't just about nailing that one interview. It's about using tools and strategies that support your whole career path.
It's the long game.
So let's bring it all together. What does this really mean for you? This deep dive, I think, has shown us that succeeding as a surgery scheduler, both in the interview and on the job, demands this really fascinating, pretty high-stakes mix. You need practical experience across different surgical areas, you need exceptional adaptability when things go sideways, meticulous admin skills for insurance and info flow, strong conflict resolution chops, and of course that crucial tech literacy combined with an unshakable ethical compass.
Quite the blend.
Understanding these specific interview questions, the why behind them, that gives you a powerful shortcut to being genuinely well-informed about what this demanding, vital role truly entails.
Couldn't agree more.
And, it's clear that the demands we've talked about, complex schedules, insurance hurdles, data security, they really mirror how intricate and interconnected modern healthcare administration itself has become. This role isn't static, it's evolving. So maybe a final thought for you to consider. What does this deep dive suggest about the future skills needed in these kinds of healthcare support roles? As healthcare gets even more digital, more specialized, how might these core competencies we've discussed today evolve?
That's a great question.
Will it require even greater tech fluency, maybe more advanced data analysis skills applied to scheduling, perhaps a deeper grasp of AI's role? It really feels like a field that demands continuous learning and adaptation. Something to think about.
Absolutely. The landscape is constantly shifting.